Howard Alderman Joe Moore. And it's been 7 days since open enrollment started under the Affordable Care Act. We'll tell you what one study says about Obamacare and employment in Illinois. Good evening. Welcome to Politics Tonight. I'm WGN TV political analyst Paul Lisnick, and this is our nightly look at politics around our city, state, and nation. We always look forward to your joining conversation with your questions and comments. Our phone lines are open for you, 877-358-CLTV. That's 877-358-2588. And, of course, you can always join the conversation on Facebook and Twitter. You just got to search out Politics Tonight. Well, as I said, it's now day 7 of the partial government shutdown. Still no end in sight, even as we approach the national debt ceiling. That's next week. Republicans are asking the president to sit down and negotiate over the budget, increasing the debt limit in certain aspects of his health care law. The president is refusing that offer, saying he won't make any deals while the government is shut down. Obama also says that there are enough votes in the House of Representatives to open the government. But Speaker John Boehner, well, he's got to call that vote first.
This morning, a senior White House official said that the president would rather default than to sit down and negotiate. Really?
We're not going to negotiate under the threat of further harm to our economy and middle-class families. We're not going to negotiate under the threat of a prolonged shutdown.
Now, one thing both sides can agree on, making sure that government workers impacted by the shutdown eventually do get paid. A unanimous decision in the House over the weekend to approve back pay for all days missed due to the shutdown. And of course, a key part of the debate in Washington is all about the Affordable Care Act. Open enrollment started last Tuesday, and there have been some glitches along the way. The national website for the president's health care law was pulled down for maintenance at off-peak hours and was brought back up this morning. Now, organizers have been trying to get the word out on the new law and how the insurance exchange program works. The exchange allows people to price compare insurance plans being offered by 6 companies. Health coverage becomes mandatory next year. Employers here in Illinois may also be feeling the effects of the Affordable Care Act. So joining me tonight in our WGN studios to explain all of this, Naomi Lopez-Bauman. She's Director of Health Policy at the Illinois Policy Institute. Naomi, it's good to see you.
Thank you. Good to see you, too.
And the reason it's nice to have you here is because you all have conducted a study taking a look at the relationship between employment and possibly the impacts of Obamacare. So let's just get this on the table. Tell me what your study looked at, what you found.
We looked at the 3 lowest wage sectors here in Illinois, and what we're seeing
And what are those sectors?
They're retail, general merchandise, and the food and beverage industry. Those are the 3 lowest paid sectors in the economy here, and they account for about 20%, about 1/5 of all the jobs here in the state of Illinois. What we're finding is that employers are cutting work hours below 30 hours for the sectors, and that's been happening since Obamacare was implemented, and that did not happen during the financial crisis, which is very interesting. But what we're concerned about is that Obamacare may be having a very detrimental effect not only to the lowest wage workers in our economy, but also to our very fragile employment state.
So, and I understand you said, well, it didn't happen before, so it's almost an, ergo, it must be Obamacare that's leading to this. But I have to ask you, in a study that was done, how do you know that the impact is related to that and not related to, again, problems in the economy? I mean, for example, I know that Jewel Food Stores, for example, which has those self-checkout lines, they've recently determined that people don't like those, so they're getting rid of them, and they're bringing humans back. There's technology factors, there's updating. I mean, how do you tie it to Obamacare?
Of course. We don't know conclusively, but we are seeing a very disturbing pattern that we did not see during the financial crisis. And it raises the question, are employers being faced with enormous increases in health insurance coverage costs for some of their workers, cutting hours for the lowest wage workers, for the part-time employees that work for them?
Of course, there could be a bit of a slippery slope here because if you're right, then wouldn't you anticipate, I don't know that the study gets into this, but wouldn't you anticipate that the reduction in employee numbers and hours, it's going to lead to other problems. It's going to lead to customer service problems. It's going to lead to lower profits for these businesses, and they don't want that. So are they kind of cutting off their nose to spite their face?
What I'm really concerned about are these lowest wage workers. If we have a single mom who is barely making ends meet and all of a sudden has her hours cut, what options does she have? She's being very negatively impacted by Obamacare. And that's what I'd like for people to know is that while we want people to have access to health care and we want them to have affordable health care coverage, this particular policy is probably undermining employment here in our state at a time when we can ill afford that.
Now, you do say in the study that affordable health, you just said it now too, affordable health care is critical. We need to have it. Everybody said, Republicans say it, Democrats say it. So it's only taken, 40 years, but finally something gets passed. And I know that you're not in the business of going to fix that law. But based on your study, are there any suggestions that you all make in the study to say, look, here's how we keep health care available without having, if indeed it's connected to the lowering of hours, without having that effect? Is there a fix to this?
Well, some of the options that we're looking at are to provide subsidies for individuals to buy health care on their own. One of the big problems that we're seeing with the exchanges is that they're loaded with mandates that you have particular coverage, which is great, but it doesn't give individuals enough flexibility in choosing what best meets their own individual needs and preferences, and it also drives up prices. And what we are seeing the federal government is telling us that we've got affordable health care coverage, but if you look at the numbers closely, you'll see that, for example, a young man in Chicago today could, if let's say he's 27 years old, could buy coverage on the individual market for about $77 a month. They're asking him to pay $200 and the Obama exchange. And so the question is that really affordable?
Okay, but there's also true, just to be fair, and I know there's been a lot of studies about folks getting insurance over the age of, say, 55 or at the age of 55. And it is true that while the numbers and average numbers are higher, I think the number at 55 is $314 a month or something, but there's also a lot of benefits you didn't get before that are now paid for 100%, and that serves, from what I understand, to kind of level out the process.
Well, I'd really like to see that, because one of the things that we have been asking the government to provide are details on these health insurance plans. You've got out-of-pocket costs, you've got deductibles, you've got co-payments, you've got a lot of costs that go well beyond the premium, and the government hasn't revealed the detailed information about the plans, and that's what we're looking for.
I'm going to take you off the study for just a moment. If it's not a fair question, you can tell me that. But, recently on the show, we discussed minimum wage and the fact that there's all sorts of efforts and strikes and people saying we've got to raise the minimum wage. And then there are studies that show that's Armageddon for business because, everyone's going to lose profits, that kind of thing. I mean, the point is, if we're all in agreement that we need affordable health care and we want people to make a decent wage, then once again, how do you fix it? Everybody's got to play the game, right? Young, healthy people have to buy coverage to make this work.
They absolutely do, but I can tell you right now that a lot of young people are looking at the prices of the coverage that's available. They weren't buying it at $77. Why are they going to buy it at $200? It doesn't make any sense. It's not affordable to them. Even if they get a subsidy, in most cases, they'll still be paying more. And so I think that whenever we look at the best ways to meet the needs of individuals, particularly the low-wage individuals who don't have health insurance coverage now, there are much better ways. It's time to go back to the drawing board.
Just very quickly, Obamacare seems to be here to stay. Are these fixable? Can Congress pass some things and fix this component, or is it flawed at its base?
I think that we're going to see down the road that it's going to cause more problems than what we're actually trying to solve. In fact, some of my work that I just released shows that this, basically, Obamacare in 2014 is going to be a massive expansion of Medicaid and not actually providing true health insurance for individuals.
All right, we're going to keep an eye on it. Naomi Lopez-Baumann, Director of Health Policy at the Illinois Policy Institute. Thanks for being with me. I appreciate it. Congratulations on getting the study done. When we come back, kicking off our 50 wards in 50 days, Project Alderman Joe Moore of the 49th Ward is in the house. He'll join me after these words. I see him now.